Hi doctors, welcome to the new episode of our A to Z series where every day alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode P where P stands for Pellagra. So let's begin our discussion. What is the probable vitamin deficiency in a patient who displays symptoms of diarrhea, memory impairment and a distinctive rash as described in the picture? Option A, thiamine. Option B, NIACIN. Option C, cyanocobalamin. And option D, ascorbic acid. So which option do you think is the correct one? Well, yes, option B, NIACIN is the correct answer. So now let's understand what is pellagra. A deficiency of NIACIN causes pellagra, characterized by 3 Ds: diarrhea, dementia and dermatitis. Castle's necklace is seen in pellagra. What are the causes of pellagra? Diet with NIACIN deficiency, tryptophan deficiency in the maize-based diet, tryptophan malabsorption in hartnup's disease. It is caused by the malabsorption of tryptophan in the intestine. Now let's understand a little about hartnup's disease, blue diaper syndrome. Tryptophan malabsorption syndrome. It is caused by a defect in the neutral amino acid transporter specific for tryptophan. It is responsible for both absorption along the intestine, if not Hartnup's disease, NIACIN deficiency, reabsorption from the renal tubules. It causes aminoaciduria. As the tryptophan is present in urine and exposed to air, the indole ring of the tryptophan will get oxidized to form ketol compounds and produce a blue color. This causes a blue discoloration of urine, blue diaper syndrome, produce a blue color. In carcinoid syndrome, tryptophan is predominantly used to form serotonin. Thus, tryptophan is not available for NIACIN synthesis, NIACIN deficiency. In vitamin B6 deficiency, it inactivates kynureninase. Thus, the precursor tryptophan cannot be used in NIACIN synthesis. Leucine pellagra. Leucine inhibits quinolinate phosphoribosyltransferase transferase in a leucine-rich diet, for example, a sorghum diet. Symptoms of NIACIN insufficiency can be classified into gastrointestinal findings, skin findings and neuropsychiatric findings. So let's discuss them one by one, starting with gastrointestinal findings. Poor appetite, nausea, epigastric discomfort, increased salivation and abdominal pain, gastritis and achlorhydria, glossitis, soreness of the mouth and dysphagia. The tongue becomes beefy red and appears raw due to the atrophy of papillae. Diarrhea is typically watery but is occasionally bloody and mucoid. In skin findings, we have erythematous skin with a burning sensation. The distribution is typically symmetrical and bilateral in sun-exposed areas of the body. In addition, there can be a bulla named wet pellagra. Malar rash, the dorsum of the hands and feet, and the neck area are common areas. The skin findings of NIACIN deficiency which responded to NIACIN treatment have been described as an initial manifestation of Crohn's disease. Now let's move ahead and discuss the neuropsychiatric findings. Lethargy, apathy, depression, anxiety, poor concentration and irritability, disorientation, confusion and delirium. Eventually the patient may become stuporous and comatose. Muscle weakness and paresthesias may be evident in clinical examination. Oral therapy with nicotinamide or NIACIN usually is effective in reversing the clinical manifestations of pellagra because patients are often malnourished and have other vitamin deficiencies. Provisions for a high protein diet and the administration of B complex vitamins are needed for complete recovery. So that's all for today. Thanks for watching and see you in our next episode, which is going to be episode Q.